Monday night to you. I am Thabo Mkhuli, and thank you for joining us tonight on the Newsfeed Late Night. South Africa has reportedly vaccinated over 10,000 healthcare workers since the Johnson & Johnson vaccine arrived in the country this week. Now, to get a picture of the current rate of vaccination, I'm joined by the CEO of Right to Care, Prof. Ian San. Also joining the conversation is University of KwaZulu-Natal Acting Deputy Vice Chancellor for Research and Innovation, Professor Musa Moshabela, and Professor Mina Goga from the from South Africa Medical Research Council. You can also be a part of this conversation. Tweet us tonight at Newsroom405 or send your WhatsApp questions and comments to 072 110 5584. We'll get into that conversation then. Good evening to you all, and thank you very much for joining us on the Newsfeed Late Night.
Good evening.
Good evening.
Good evening.
Prof. Ian, I'll start with you tonight. A lot of people are asking the question, why are we participating in this vaccination program through the Sisonke process? And what does that mean? What is the Sisonke Together program, and why did we have to participate in that program in order to have the vaccines approved?
So just about 20 days ago now, we realized that we were going to struggle to receive a vaccine, and the real leadership of Glenda Gray, the president of the SAMRC, brought together the Sisonke team, meaning together, to in fact bring Johnson & Johnson vaccine to South Africa. Because this vaccine has just completed the phase 3 trials, and the submission to SAPRA and other regulatory authorities is underway, the program had to be structured as a clinical research program. It is essentially an early access study with in a phase 3B design, which means that in essence there's no control group, everybody's getting vaccine. But we are obliged to inform every participant that they are participating in a study, and we do require e-consent. And then indeed we do monitor the outcomes, both safety outcomes as well as viral effectiveness outcomes, to see how many of those healthcare workers vaccinated actually do in fact have COVID infection at a later stage, and potentially hospitalization or severe infection. From the clinical trial, we expect there to be a viral efficacy of around 57%. So the clinical trial showed 57% clinical efficacy, viral effectiveness to prevent mild to moderate disease, and 85% vaccine effectiveness to, in fact, reduce severe disease. Yeah. And there were no deaths in participants who had been vaccinated. Yeah.
I tell you why I'm asking you that, and I understand the results, and we'll get into them in just a moment. A lot of the healthcare workers we have spoken to, I'm saying a lot, I've probably spoken to 3, but they represent unions and so forth of nurses and the likes. They've been raising the question as to why use the research program to make the vaccines available. They feel as though nurses are being used as guinea pigs in this process.
Yeah, so that's far from the truth, right? So in essence, when we indeed have effectiveness in phase 3 trials, there is a lag of around 2 months before the vaccine is fully registered in any jurisdiction, whether it be in the United States or Europe. During that period, an early access program such as this is quite common. And indeed, the safety of the vaccine is then measured still with a 2-weekly reporting to SAPRA. So I don't believe, I think we've got really good data to show it is effective, and nurses and doctors are asked to participate. They are informed fully before they enter into the study, and particularly around their willingness to provide us with data and to contact us if there are side effects of that they may be experiencing. most of which are what we call vaccine responsiveness or a vaccine reaction. But indeed, those reactions generally are good because that means the immune system is responding.
Yeah.
Any participant who doesn't wish to participate can wait for the registration of this vaccine, which is anticipated in the next 6 weeks or so. After that, the South African Department of Health has agreed to purchase, and it is on the procurement schedule for the Department of Health to purchase 9 million doses.
Yeah. So under the Sisonke Together program, how many are we going to get?
So the program is planned for 500,000. We need to get to 300,000 in the next 3 weeks to get the balance of the 200,000. But indeed, I think we're well on track. It is really hard work. But indeed, we're on track to receive 500,000 doses.
Professor Musa Mushabe, let me bring you in here on the 18th. We were vaccinating, 2,200. The 19th of February, according to the data that's been input now, 4,264. We're reporting now at least about 10,000. And when you do your mathematics, 1.2 million is what we need to reach in 3 months. Is that doable?
It's a very good question, Thabo. I mean, the 10,000 or so represents about 1% of the 1.2 that we need to vaccinate. And logistically, I think in terms of geographic coverage, the sites that we are using are still limited. They're still very centralized. But under the current arrangements that we have, it's understandable that we have those restrictions, as Ian has already explained. However, I think that there is a need to think about how to scale this up, and it will be good to actually see in the next couple of weeks how that scale up is going to happen to cover a larger geographic area. Otherwise, the people that are in the remote sites are not going to get access to this vaccine.
Yeah. Why was it important, Amina, for the South African Medical Research Council to have these vaccines available at this time? And when it became clear, when we had the million or so AstraZeneca vaccines already in the country, that they're going to be 22% effective against the 501Y-V2 variant, why was it important that we expedite the Johnson & Johnson process, considering that there were trials already going on in South Africa and elsewhere in the world?
Thanks very much for the question. If we did nothing, if we made no decision at the time, it means that health workers in South Africa would have to wait until the vaccine or a vaccine is registered in the country, which would take approximately 2 months. We know that we've had the first wave of COVID-19. We've had a worse second wave. The second wave came earlier than we anticipated, and we know that we will have a third wave. And so what we really wanted to do is to offer a level of protection for health workers before the third wave, because they have been at the front line of COVID-19 infections. And so they have borne the brunt of the disease. Of many categories of workers, health workers have been severely affected. And so in order to do that, our only option was to offer access as part of an early access program, as Ian has said, which is a phase 3B open label study. And we call this Sisonke, all of us working together to get early access for health workers. And if you remember, health workers were part of the phase 1 government rollout. So we're still sticking with those 3 phases that the Department of Health had identified. And this is the start of the phase 1, which identified health workers as the key population. But we're doing this now through a phase 3B open label program. It's completely voluntary. It is not compulsory at all.
Right. And those numbers, estimated to be around 40,000 healthcare workers who contracted COVID-19 and 6,473 of them hospitalized, while 663 have died. And those are some of the figures that have been bandied about. It could be more, it could be less than that. But there is also the emergency use listing with the WHO. Why is that process necessary, and why is Johnson & Johnson going for that? While, of course, we've got our own other systems here, SAPRA, looking at giving approval to this vaccine. Amina?
So I think the first thing to do is to go for an emergency use authorization, because that fast tracks the process. The emergency use authorization has been applied for overseas, and with SAPRA, we do have a rolling submission with SAPRA. So I think in our context, it's not that there is no study or in constant contact with SAPRA to discuss fast tracking the registration of the J&J vaccine in South Africa. So I think it's not a dead end, but we are pursuing the emergency use authorization or the fast tracking for the registration of the J&J vaccine.
All right, we come into the details then of the vaccine and how it works when we continue next on the Newsfeed Late Night. I believe it has shown fever in about 9% of those who were vaccinated. There's been also some fatigue, headaches and muscle aches that last for about 24 hours. Is that what we should be expecting from it? But also, what are the other benefits that come with this vaccine? And what do we need to look for? That's what we're talking about when we continue next. You can also be a part of this conversation. Tag us on Twitter at Newsroom405 and WhatsApp us your questions and comments to 072 110 5584. The Newsfeed Late Night continues next.